I'm Lisa Federico, and this is Inside Northwest Columbus. After spending decades in corporate marketing, I traded boardrooms for backyards because the best stories are happening right here at home. Every week, you'll meet entrepreneurs, creatives, and everyday neighbors doing extraordinary things across Worthington and Northwest Columbus. So let's jump into this week's conversation. Welcome to this week's episode of Inside Northwest Columbus. I'm your host, Lisa Federico, and I am joined today by Dr. Nikhil Verma of Essential Sports and Spine. It's so great to have you here.
Oh, appreciate you so much for having me on this episode. I'm looking forward to it.
Well, it is our health and wellness month that we are focusing on, and you are doing some incredible work in our community, and I'm just so excited to have you on.
Yeah, I appreciate it. And it's serendipitous, the time of the year. You know, the beginning of the year, it's probably the best time to start taking your health a little bit more seriously and see if we can have a better 2026.
I totally agree with you. I think at this time of year, we always think about what are the things that we can do to have our best year ever. And I think one of the best things that we can do is survey what are we doing for our health, right? What are the things that I want to solve in the new year? And you help people solve pain issues, which can be overarching in terms of entering all facets of our lives. Tell me a little bit about, you could have specialized in so many different areas in the medical community, right? Tell me how Essential Sports and Spine came to be.
Yeah. So again, growing up, I've always had an interest in the sciences, the maths, the sciences, and it was great for me in my high school days studying biology. And when we went to pick a major for undergrad, I wanted to go pre-med. Yeah. And a lot of influences throughout my life, but really the kind of turning point that I discuss a lot is when I was in high school, I had a back injury playing football. And it kind of sidelined me from sports. I was playing sports all year round, out with my friends, family, enjoying sports, playing sports, training for sports. And when I had that injury my sophomore year of high school, it really was an emotional hit to me and my identity. So I became a little bit more in tune with physical therapy, stretching, strengthening, and ways that we can heal ourselves, because what the current medical system had in place then was either injections, which are detrimental toward tissues, or surgery, or nothing. And none of those really seemed to sit well with me. So I went on this journey to try to figure out what other ways are we able to naturally heal ourselves. And that's kind of where I wanted to proceed with opening my own practice to help people heal themselves naturally.
Yeah.
Now, granted, we'd still use some of these other traditional methods with injections, but those are usually more for diagnostic purposes. And we can use some of the therapies that we'll surely talk about later.
Yeah. And you do offer a wide plethora of alternative therapies that help people maybe avoid surgery. And I love how you talk about the types of protocols that help heal the body on your own. How did you, and I know that you had this injury in high school, but as you started in your practice, how did you come to view these other protocols as necessary outside of what people might normally think of for surgery?
Yeah, that's a fantastic question. Really, it'll take us back to another story. When I was doing my residency, I wanted to do sports medicine because that's the kind of injury that I was dealing with. And when I was doing a lot of the rotations, it was the same concept of just steroid injection, surgery, steroid injection, surgery. I was fortunate enough to get into a rotation during my residency with Jared Malanga, who has passed away, unfortunately. He was a great mentor to me because he showed me that there was a different way to care for patients and to address patients and their needs and what they're dealing with. And he introduced me to these therapies such as platelet-rich plasma, stem cell therapy, micronized fat therapies, ozone therapies, all these topics that weren't talked about in the mainstream medical education books, but are now becoming very widely popular. And we know tons and tons of athletes that are getting these procedures done yearly.
Right.
And I'm trying to extend that to the general population because these procedures, they work and they work great.
Yeah.
And they can help even, someone that's just looking to get out and play another round of golf.
Right. Just to kind of better their lives again for 2026, talking about resolutions, how I can be more active. And if the pain is holding you back, I don't think a lot of people realize that there are other alternatives besides shots and surgery, because I think that's what we've been told, right, from the very beginning.
Absolutely.
What are some of the therapies that you're seeing that are really moving the needle, no pun intended, for your patients?
Yeah. I think what's special about our practice is everything's individualized. Yeah. I take a good assessment of what's going on for that individual when they come into the office. I'll take a thorough history and physical exam, go through certain physical exam and functional exam maneuvers to make sure, am I missing anything? Am I not missing anything? What are we honing in on? And then any imaging that might have been provided. Usually MRIs, I will make sure that this patient brings the MRIs themselves so we can take a look at them together and I can actually identify what is going on.
Yeah.
Sometimes we add in an ultrasound examination as well. But to answer your question, overall, the treatments, it varies. If someone has a mild to moderate injury or pathology, then something as simple as just laser therapy can work great. But if there's something that needs a little bit more attention, then maybe we do something like platelet-rich plasma, or if there's more of a large rotator cuff tear or tendon tear, then we might want to think of some stem cell therapies to help. Now, the great thing about these therapies, technologies, I'll call them in this sense, we can stack them all together. And when we stack them together, then we get even better results.
Right. And the design is such that, like with laser therapy, you're trying to get the body to heal itself so that you're not in this perpetual state of shot surgery.
Right.
So let's talk a little bit about laser. What exactly is it? What does it do? What is the benefit?
Yep, it's a great question. So I'm going to use a big term here, photobiomodulation. So we'll break that down into the actual word. So photo, light, biology, modulation, changing of cells. So that's the whole idea of what laser therapy does. We're changing the cells at the surface level to increase blood flow, to decrease inflammation, to decrease pain, and actually activate some of the pathways in the mitochondrial chain to help increase the energy in that area. So this can activate dormant stem cells. This can also decrease, as I talked about, decrease inflammation, decrease pain naturally, and increase blood flow. And these all have beneficial effects for someone going through a painful condition. And now this works great for both acute injuries. Say I've rolled my ankle and I'm having this ankle injury, and I actually did that for myself, or someone that's had hip pain who's nearing a time for hip surgery. They might come and get great benefits too. And actually, that's one of the patients that I'm dealing with right now. She was actually scheduled for hip surgery in February, and we didn't do anything else but laser. And she's already saying, I have more range of motion. I can do my yoga again. I can go on walks again.
Isn't that great?
So it's amazing. And it's amazing for me because I trust in these therapies, and she trusted in me to guide her along the way.
Absolutely. When someone has laser therapy, is it painful? Like, talk with me a little bit about what it entails. What can people expect?
Yeah, for laser therapy, thankfully, it's the least invasive, non-painful procedure that I offer.
Yeah.
It is a Class 4 laser, meaning you need a medical license and you need to be kind of trained on how to use it. You can only do these at physicians' offices or chiropractic offices. But for the most part, for the body part that we're focused on, there's different parameters that we set prior to, and then we turn on the laser. Sometimes if there's more acute painful spots, there's a handheld piece I can put on the hand on that site.
Yeah.
But for a patient, for example, back pain, I can just put on the automatics function and put it on their back and let it go.
Right. And is it light or is it heat or a combination of both?
It's mainly light that's
Okay.
non-thermal, so there's no actual heat residue. Now, patients will say, oh, I felt a little tingly, I felt a little
Yeah.
warmth, but I think that's more the body reaction and not actually reaction to the light.
Yeah, but the light is stimulating those cells that are, for lack of a better term, injured,
Right.
and helping to either create new cells, right, or reduce inflammation. And when you reduce inflammation is when you reduce pain. Do I have that
Yep.
right?
Yep. That's pretty much exactly what the goal of a laser therapy would be.
Yeah, and the medical establishment doesn't typically utilize that as a protocol. Right?
Right.
Like you had said, it's mostly cortisone shots and surgery.
Yeah.
Why is it? I mean, if it's working so well, why aren't most traditional medical practices using it?
I think we go up against a lot of academic medicine that wants to, I wouldn't say handcuff these therapies, but there's not a big enough utilization and availability to patients.
Yeah.
So we can't get large enough studies to prove that these are effective treatments for enough patients. So what you're forced to do is you have individual practitioners like myself that will buy these machines and use them on the patients. And then we have to go on the back end and make our own databases and our outcomes. And then we have to go back to all these journals to prove to the establishment this actually works.
Yeah.
And it's actually fascinating because laser is one of the fastest growing treatment options in the US right now. There's clinics that are just popping up all over the US that just have laser therapy, which is fantastic. But in itself, it may not be enough. And that's why I have the other treatment options available.
Right. So anyone who has knee pain, hip pain, shoulder pain, potentially the laser therapy could be like ground zero or like level 1 for how you might start a protocol.
Yep.
Stepping up from there, like you mentioned, stem cell and PRP. Can you talk a little bit about stem cell therapy and what it is, how it works? Because I think some people might think that stem cell therapy is very like woo-woo and not proven, but actually studies are showing that it's very, very effective.
Exactly. Yep. So if we want to continue on the stepwise progression of how things work, let's talk about platelet-rich plasma first.
Okay.
Just because that's kind of the next natural stepping stone. Well, there's also prolotherapy. I'm not going to get too much into that because it's not as much of a regenerative therapy as it is more of a natural therapy.
Okay.
What prolotherapy is a concentrated dextrose water. And we can use this for injections into facet joints, into ligaments, into areas around nerves, and it can help with all these painful areas: nerve pain, facet joint pain, trigger point injections. It's a natural substance, and it's not detrimental to the body like steroids would be. So that's kind of like the next step. I don't use it that frequently, but it is an option in the playbook.
Okay.
Then we go to platelet-rich plasma. Platelet-rich plasma, or PRP, is where we draw off your own blood and we spin it down and concentrate the platelets that have an abundance of growth factors and other peptides and other cell signaling molecules. And when we re-inject this into injured tissues or around the sites of injured tissues, it starts a cascade of healing by bringing in growth factors, new blood vessels, bringing in progenitor cells to start cleaning up the old tissue and start making more healthy tissue. And it's a little bit of a biology trick where it changes the type of cells in that area from a chronic inflammatory cell into a more mediated cell. And the macrophages literally change types. And that's what's really cool and interesting about platelet-rich plasma. It works really, really good for mild to moderate osteoarthritis, some ligament injuries. In my practice, we use it a lot for intradiscal therapies, epidural injections, and facet joint injections.
Yeah. We're taking just a quick break, but before we jump back in, I want to give you a sneak peek at what's coming this February. Our Love Local issue is all about celebrating the businesses, makers, and service providers who add real value to life here in Northwest Columbus, in the people who make this community feel like home. On the podcast, we're sitting down with passion-driven owners who are doing business differently and pouring heart back into our neighborhoods. You'll walk away with new favorites, fresh perspectives, and a whole lot of pride for where we live. Make sure you're subscribed so you don't miss an episode. And don't forget to grab your free digital copy of the magazine. You'll find the link in the show notes below. And plasma typically is supposed to do what? Like what's its purpose in the body?
So it's really the plasma is not the portion that we're doing anything. The plasma is just a fluid that carries the blood products.
Okay.
So what we're doing is we're actually taking the platelet portion. That's what's the most important for us. And if anyone gets cut, the reason why we heal is because platelets get exposed to the oxygen in the air and whatever substances, and they automatically open up and they start doing all those processes. And then that's why you heal. So that someone was like, why don't we take that, concentrate those platelets and re-inject them into more injured tissues and see what happens? So that's the whole idea of where regenerative medicine started from in the platelet-rich plasma field.
I see. Okay. And so then as a step up from the other protocols that we've talked about, again, this is still healing the body on its own. It's not like you're introducing other chemicals into the body.
Right.
Your own body is healing it through the platelets that you're extracting from the blood.
Exactly. 100% correct.
It's incredible.
Yeah. It's crazy how well this works for our patients as well. I'll give you another story example. 71-year-old female, been to multiple surgeons, multiple doctors, back pain, had epidurals, burning of the nerves, had a little bit more invasive procedures as well. Nothing worked. And she was finally like, I'm fed up with it. I'm either going to have a big surgery or I'm going to try this. And she said, I can afford it. I'm going to put off my 1 year vacation because I can't even enjoy it anymore. And she did a platelet-rich plasma. And she came back 4 weeks later, 75% better. She was able to walk over 1,000 feet, which she wasn't able to do for the past 2 years. So we know these therapies work. And we're really trying to hone in on where exactly they were.
Right. And I think a big part of it is just the education that there are different protocols out there besides what you traditionally get from traditional medicine.
Exactly.
And we need to do a better job, I think, of educating patients about what's available, what doctors like you are offering.
Right.
It's incredible. Okay, so let's talk then about this next level, which I think is stem cells.
That's correct. Yep.
This is fascinating to me.
So we'll go back and talk a little bit about the legality of this because there are stem cells that are being publicized out there that's saying, oh, I have an IV stem cell therapy place. I have IV stem cell this, and we do stem cell therapy. A lot of these places that do that are actually not following the current FDA guidelines. So we do not have legality to use exosomes and off-the-shelf products like Wharton's jelly into musculoskeletal injuries currently in the U.S. So the places that offer that, I'm not saying they don't work. I'm just saying they're not doing things that are kosher within the eyes of the government currently.
Okay.
So what we do in our practice is we, again, extract the cells from our own patients. So we call it autologous, our own body cells.
Okay.
And we extract it either from the bone marrow or from the micronized fat, from the fat cells.
Okay.
And we process them same day in the office. We cannot add anything to it. We can't manipulate it more than minimally mechanically. And then once we get that cells back to a concentrated site, we re-inject that into the injured tissues. Now, this is kind of where the magic happens because platelet-rich plasma just kind of sends out a robust signal to, hey, we need some healing.
Okay.
When we actually take these other cells, we actually implant some cells, some stem cells and other cells in that region, which will then later differentiate into this kind of tissue in that area. Now, one thing I can't say is that does it actually regenerate? That's one thing that the FDA doesn't like us saying, but we do see better MRIs and x-rays after we do these. But more importantly, and what's most important for me, are you able to function better?
Right. I mean, isn't that what we're after? I don't know that a lot of people have said, wow, that back surgery, that was the best thing I ever did, right? I know very few people who have had fantastic outcomes. And so you giving people other types of options, right? As long as you're feeling better after the fact, right? we're doing some good in the world.
Exactly. That's how I like to view it, and I try to explain to my patients, like, it's great if we get these MRI changes, but if you're functionally better and be able to hike and play golf and go on your vacation and enjoy it again, that's way more meaningful for me.
Yeah. And being active is so important, especially as we age. And I do think many times, right, we may back off of some of the physical components of our lives because of pain. And it's probably not the right way to go about it. We should be looking at maybe some other protocols to help us continue to be active.
Right. And I think the more active we are, especially the older we get, we decrease the risk of hip fractures,
Yep.
which have a high incidence of, unfortunately, mortality and morbidity. Even after 2 or 3 years, we have a decreased risk of osteoporotic fractures in the spine, less falls, less neurodegenerative diseases, less cardiovascular diseases. So all these things are important. And that's why I love the musculoskeletal health system, because if we can fix that and get you moving and active when you're younger, or even a little bit older, then you're going to have better outcomes across the board.
Yeah. When we talk about stem cells, do they regenerate? Tell me a little bit about what stem cells do. And then I want to go back to something you said about some of the therapies that you're seeing on the market, which are not necessarily FDA approved.
Yep.
But let's start with the stem cells. What do they do? What's their function? And then how do we use those, right, to get the results that we're looking for?
So again, I'm going to be hesitant to say they actually regenerate anything.
Yep.
But ideally, once they're injected into these areas, they're going to release growth factors, and they're going to activate other cellular pathways. And there's actually a naturally pain decreasing molecule. And these are all emitted at high concentrations once injected into that area. Yeah. So if it doesn't necessarily build something back up, it at least makes a scaffold for the area to allow your body to build something back up. So if it doesn't do it directly, at least does it indirectly. But then you have natural pain relieving, natural decreased inflammation, better blood flow, better oxygen to that area, and just a better healing environment overall.
And because it reduces inflammation, that's where you get some of the pain reduction. And this also occurs right within your own body. It's not like you're putting other kinds of medications or chemicals in.
Exactly. That's exactly right. That I think the little bit of the fringe sciences are trying to say, does it regenerate? And, what are the other things? And I think, unfortunately, we just don't know quite yet.
Yeah.
We have a bunch of data on what is excreted, but we don't really know why things work exactly how they work right yet. And that's kind of where we're at in the both lab work of these regenerative medicine therapies and also in the functional, actually helping patients.
Yeah.
So.
What is going on in the world of research, right, towards these therapies? Because like we talked about, they're not readily available to everybody.
Yeah.
And so what are some of the things that they're finding? And talk a little bit about the evolution of how some of these therapies come to market and what has to happen in order for people to embrace them.
I think just like anything else, we need to have just higher powered studies, and high powered studies means we need lots and lots of patients.
Yeah.
And we need to show that the outcomes are at least as good as the current standard of care. And that's not too hard to prove because the standard of care are steroid injections for the knee, for example. PRP already has been shown to be better than steroid injections to the knee when we concentrate the cells to a high enough level. Now, we have a lot of pushback from a lot of the societies, we'll say orthopedic societies, because they say, well, these studies don't show any benefits. And then if we as regenerative medicine experts go back and review the literature, it actually shows that those studies designs were very poor. They weren't concentrating the cells very well. They weren't following protocols. They weren't using image guidance for their procedures. And they're just kind of getting a small amount of blood and then re-injecting it. And that's not really what the standard of care in this regenerative medicine field should be.
Yep.
I think also we need to show that this is cost effective. I think that's the other thing. These can be quite costly for some patients, and we don't have a guideline of this is how much it should cost.
Yeah.
And I think there's a lot of people out there that are overcharging and some people that are undercharging. And then there's a bunch of people in the middle.
Yeah.
So I think those are two things that we're going up against. I just also think it's so new and we're still trying to figure out why these things work and how we can improve our techniques and our skill sets. I think that's another thing that we're dealing with right now. And then I think the last point I want to make about any pushback is we don't get a lot of funding for this.
Right.
A drug can go on market very easily because pharmaceutical companies have put off millions and millions of dollars for any of their drugs they want to research. But we may have thousands, maybe tens of thousands of dollars for research for regenerative medicine. So we're going to be behind the eight ball for a little bit until we can try to get these leaders in the field to try to push better medicine out there.
Yeah. But there is more chatter about it. I mean, I do think we're starting to see a little bit of a groundswell. Do you feel like regenerative therapies are right on the horizon, like we're right on the cusp?
I wouldn't say right on the cusp. I would probably say you got to give it another 5, 10, 15 years.
Yeah.
I think what we are doing in the musculoskeletal health field is amazing, and I think we're getting a lot of data there. But a lot of the academic centers are doing it for organ recovery, neurodegenerative diseases like Parkinson's and ALS, and some other of the more rare diseases. And I think that's really exciting, and I've read some of those studies, and it's interesting to see what they're going to come up with. A lot of the animal studies are really promising. A lot of the studies with this laser therapy are very exciting because that kind of started with the animals. And the great thing about animals is if they're in pain, there's no placebo effect. They're either out of pain or they're not. So once they realize that, like, hey, we need to start doing this in controlled human trials. And that's where we got the FDA approval actually for the laser therapy.
Yeah. Didn't get the magazine at home? No problem. You can read it for free by signing up for our digital issues. Just head to the link in the show notes. And hey, if you're just listening to this episode, did you know you can watch it too? Catch the full video on YouTube, link below. And what's on the horizon? Like, what are some things, for example, we've talked about peptides, and I know you've talked a lot about on your podcast about how, you know, the peptides are starting to show some promise. What do you think is like the next big thing? What's coming down the pike that we should be aware of?
I think I talked a little bit about the things that aren't legal in the U.S. right now, and those examples would be like something like exosomes. Exosomes are essentially little packaging molecules that have high amounts of information in it. And then when those are injected to these troubled sites, they may have a more robust signal. Okay. Right now, we're not able to use that in the U.S., but some places outside of the U.S. do have high-grade exosomes that they're using in their treatment.
Where do the exosomes come from? Is that from plasma? Is it from
It's from different cellular,
stem cells?
Different cellular body parts of our cells. So it could come from the plasma, it could come from the stem cell bone, it could come from the fat. They come from different areas. What's interesting is they've also had donor cells, and that's where some of the legality comes in. Highly controlled studies in the U.S. do have some donor cells, but more on the outside of the U.S., there are donor cells for exosomes as well. And they're showing some promise. Another thing we're not allowed to do in the U.S. is to culturally expand the cells, meaning when we get the cells, we can't put them in a petri dish, put them in the fridge with some growth factors and let them grow for any amount of time.
Okay.
We're not allowed to re-inject that into somebody right now.
So it has to be taken from you and put back into you in the form that you took it out of.
Yeah, we can minimally mechanically alter it.
Okay.
Meaning we can use centrifuge machine to concentrate it, but we can't start adding things and this and that.
Right.
So those are probably the two biggest things that we'll see in the next few years. I think also what's going to probably happen in the next 10 years is we're going to go away from using steroid injections as our first line therapy, and we're going to use more things like laser and some other cellular therapies as our first line.
Yeah.
And then peptides, that is the hot topic right now. We have peptides obviously for weight loss. That's what a lot of people are using them for. But we know that there's a couple other ones out there, BPC 157 and TB 500. These can be utilized with these musculoskeletal injuries to help healing. Now, again, FDA doesn't approve these in the U.S. and we don't have any clinical uses for them. So these are all either theoretical or what people are doing in the gray market, as we'll call it.
Right. But we won't know until we start to try, right, some of these therapies to know how effective
Exactly.
They truly are.
Yeah.
But the ones that you're using are giving your patients relief and allowing them to get back to doing the things that they used to do 10 years ago.
Exactly. Yep. Right.
Yeah. How do we take care of ourselves when we start sports, for example, at such an early age? I've heard a lot of people say that, when I was a kid, we only did baseball 2 weeks out of the year, and the rest of that we took a break. And now, right, the kids play sports all year long. And I think that as a society, we are becoming more physically active, but with that comes wear and tear on the body. Are there things that we should be doing to take care of ourselves, right, ahead of time that may help to alleviate some of these issues that we get older in life?
Yeah, that's a great question. I read this saying one time in my life. I forget where, so I apologize if someone does know it. And the saying was, the best form of exercise you're doing is the one you're doing. Right. And I said, okay, that's great. Yeah, so if you like to run, you should run. If you like to lift, you should lift. Mm-hmm. But I then kind of reworded it to saying, okay, well, the second best form of exercise is the one you're not doing. Meaning, if you like to run and that's all you do, then you better get in the weight room. If you like to only lift weights, you better start running. It's really having the cross-sectional training of throughout all sports and activities. I like to vary it up to have a couple days of longer form cardio. We should really be lifting heavy weights 1 to 3 times a week, depending on what heavy means for you. Yep. You should do some sort of cross training once or twice a week. And some of these can be the same time, right? You can do cross training and have a cardiovascular workout at the same time. They're not mutually exclusive. Right. And I think that's kind of the baseline of where we should start. And then longevity, if we're talking strictly longevity, VO2 max training, really getting your heart rate to about 80% of what your capacity
is. That what VO2 max is?
Yeah, essentially. I mean, it's VO2 max means how much oxygen your body can extract when you're exercising. Yeah. So the better VO2 max you have, the better your longevity is. And that's what most of the studies are showing right now. Okay. But it's not a measure you just go and check. It's something you actually have to train to get your body up to.
Yeah.
And then outside of that, I'm a big advocate for yoga, stretching, 10, 15 minutes every day. You need to be spending working on your tissue and stretching and keeping yourself active. Yeah. I like to do it first thing in the morning. In the winter times, it's hard to get up in the morning, so I try to do it more before I go to bed now.
Right.
But I think it's really important. I think those will keep you moving and get you going. And when things start breaking down, you don't ignore it. You go to the physical therapist, you go to the chiropractor, get the hands-on training, get the kinks worked out. And then when things still don't break through, that's when you come see someone like me and get you over the hump.
Right. So you recommend looking at a chiropractor. You recommend chiropractic care.
Yep. Yeah. Yep. I mean, just like there are good doctors and bad doctors, good salesmen, bad salesmen, there's good chiropractors, bad chiropractors.
Yeah.
The ones that I work with specifically, I trust. They do a good job. The outcomes that they show me with their patients are different than someone who's just, you need to come see me every day for the next 6 weeks, and then we'll make a new plan. I don't know if there's any utilization in that. And the studies don't show that there are. Yeah. But there are certain chiropractors that actually work functionally and try to get your body healthy.
But if someone has issues, like let's say their shoulders or hips, right? Your protocol would be to start with physical therapy, right? Maybe some chiropractic care. If that doesn't work out, then you're the next step, as opposed to surgery and cortisone shots.
Exactly. And quite frequently, fortunately, patients are coming to me after they've tried everything else. They've already had consults with surgeons. So that's really probably a better time to come see me, because you've tried everything else and you're not ready for surgery. That's actually a really good time to come see me. Yeah. But I always encourage my patients, like, if you want to come see me when you're first starting to have your nagging issues, that's completely fine too.
I think sometimes, too, we put it off because we chalk it up to old age, or it's just an injury that's never going to heal. And we have options. Yeah. But you have to seek them out.
Exactly. I agree.
Yeah. Talk with me a little bit about the cost of some of these therapies, because insurance typically doesn't cover them.
Correct. Insurance doesn't cover anything that I talked about today. Now, again, there's a varying degree of what we need to do and what we can do. But I can give you ranges. I think, you could get a PRP injection for about $750 to $1,500. And there's other places that will charge a lot more. There's certain practices that will charge up to $10,000 to $20,000 for stem cell therapies.
Yeah.
But that's probably the best range that you're looking at.
Yeah.
Now, in our practice, we don't have a one size, this is what your PRP is going to cost you, because it's individualized. I may have to inject 6 or 7 different things during my procedure. And then I'm usually stacking this on top of added laser therapy sessions, maybe some nutrition advice, so I'm really selling you in a package of your wellness plan. I'm not just saying we're going to do a PRP injection and that's all that you're going to get.
Right.
And we are starting to see better outcomes because we've changed our practice philosophy to that. At the beginning, just doing these injections, I wasn't too confident that I was giving them everything that they deserve. So that's why we've kind of changed our practice philosophy.
Right. So now you can combine these therapies to get even greater results and mobility for your clients. And, it strikes me too that insurance may pay for, cortisone shots and surgery, right? But most of us with health insurance today, we have large deductibles. So you're kind of paying for some of that already without not really getting the results that you want.
Right.
So putting that money towards, solutions that can avoid surgery,
correct,
can be very beneficial.
Yeah. A lot of these things, HSA and FSA accounts can definitely pay for. And I agree. Sometimes someone will say, oh, well, I'm just going to do this procedure, steroid injection every few months. Well, every few months, then you're paying a copay, you're seeing the same doctor, and you have deductibles and all that kind of stuff. And at the end of the day, you may not be actually saving very, very much money if you pay a one-time upfront fee and you get the long-term results.
Right.
And these therapies are shown to be beneficial 2 years, 3 years. And bone marrow,
so it's
stem cells can be up to 10 years.
Yeah.
In certain
Where a cortisone shot, you need that all the time, right?
Yeah, maybe get a year out of it, maybe 2 years at best. But most patients are coming back every 3 to 6 months. And once that starts to happen, I start having a conversation like, we need to start reconsidering what our end goals are.
Yeah. And what are the downsides of using cortisone shots? I don't know that people really think about it because it's just the protocol that's recommended.
Yeah. So actually the studies do show that in knees and hips, so we correlate this to other joints as well, is if you have even one steroid injection, it takes off the coating of your bones. So it increases your rate of osteoarthritis. Other studies have shown that it increases your chance and the speed of when you get a knee replacement.
Interesting.
So if you and I both had everything else the same and I had a knee injection and you didn't, even though we had the same degree of osteoarthritis on x-ray, I would be more likely to have a knee replacement. So this is what they don't like to tell.
By design?
Yeah, that's a good question. That's one of those ones that I raise my question about. I will say there's a lot of orthopedic doctors out there nowadays that say, hey, I will do 1, maybe 2 steroid injections.
Yeah.
But I don't want to keep injecting your knee because it's going to make it worse and your pain might get worse. But unfortunately, their next step is a knee replacement. So they might say, come back to me in 10 years. Yeah. Well, what do you do from the age of 45 to 55 at that point? That's where I come in.
You just want to suffer for 10 years?
Yeah.
Yeah. It doesn't make much sense, does it?
Yeah.
Yeah.
So that's where we come in. We can definitely help that. And again, sometimes these therapies last longer than 10 years. So it can be a win-win.
Yeah. And you offer a lot of resources for your clients. I know that you have an upcoming webcast. So check the show notes as well as Essential Sports and Spine, the website for that information. But then you also do your own videos and things on YouTube. How can people get more information about you, Dr. Verma, and your practice?
Yeah, that's a great place to start, just essentialsportspine.com. We can get it's my website, but I also have a YouTube channel called Things I Didn't Learn in Med School. And I talk a lot about healthcare things, but I also talk a lot more about healthcare policy and a lot of these topics that we talked about today and go into a more deep dive into that. I'm pretty active on Facebook and Instagram as well. Same Essential Sports Spine. So you can find those on those websites. So
Great. Thank you so much for being here today. It was such a pleasure. I love talking about this
Yes,
stuff.
I know.
It's super interesting. I want more people to be educated about the different types of protocols that are out there. You don't have to settle for the same old, and you certainly don't have to be in pain all the
Yeah.
time.
I mean, that's a good point. If things didn't change 1 year from now, where would your life be? And I'm confident that we can help change your life in that year. It just give us a chance.
Awesome. Thank you so much.
Thanks.
And that concludes this episode of Inside Northwest Columbus. We will see you next week right here on our very next episode.
Boxland Media. Think big.